is the president and CEO of Care Providers Minnesota. In dealing with this, Patty, there is so many things that we could talk about, but I really want to start with where we're at in Minnesota as it pertains to this survey and our nursing homes in this state.
I think the numbers, while they are pretty staggering, are also pretty accurate. There are a few things that tie into what causes these kind of scary statistics, and one of them is you're spending more money than you're getting in, and the other is you have a declining occupancy. The number of people using your services decreases, which means you're not getting new money to come in for any reason. So I think both the expense side as well as not getting revenue in combined together are putting us in this precarious situation.
What is the demand? How many beds are available and how many people want to get into them?
You know, we do a survey every quarter, and the last survey results show that occupancy is down to about 90 or 79%. Historically, we have been awesome in the country on our occupancy. It's been over 90% for decades, and so this is a real awakening to us. There's a couple of reasons for this occupancy dip down to 79%. One of them is when we admit folks from the hospital now, we are required, because of infection control considerations, to quarantine them for 14 days in a private room without a roommate. And so we do have many communities that have essentially taken a 2-bedroom and made it a single room, which means you don't have those beds occupied. The other thing that's a driver is staffing. We can't admit people who might need our services because we don't have enough staff to take care of them. And that has just been exacerbated. We've always had a chronic staffing issue, but it has been made much worse with the advent of COVID and community spread, where staff need to stay out of work for 2 weeks or even longer.
Yeah, and with all of that said, Patty, what are the solutions? What can you do?
Well, I do think that we need to have some reimbursement flexibility so that there's an acknowledgement that this is a significant problem that requires a longer term planning and solution, that we are going to have to look both at the state and federal level for monetary relief. We need to figure out, too, on a more longer term basis, how we can look at our profession as a profession that would be an honored profession, that people will want to work for us. And one of the ways to do that is to make sure that we pay livable wages for our workers. And so I think some of the solutions are short-term bridge funding solutions, and some of the solutions are really longer term. Let's take a look at long-term care as a profession, not just for the workers, but in terms of prioritization of caring for our seniors.
How much? I know for a while at the beginning of this pandemic, our long-term care facilities were really a primary focus for lawmakers. Is that still the case, or do you feel that that has kind of dropped off and we're looking at other areas because of this virus?
You know, I think we do have some concerns because at the end of the year, right around the corner, December 31st, a lot of the funding that came available through either the Federal CARES Act or Provider Relief Fund goes away, and it doesn't mean our expenses go away. So we are going to have to continue with our very aggressive testing program without having the money to do it after the first of the year. So we are concerned about what's going to happen when all of the programs that had been in place in 2020 disappear, the funding programs. How are we going to pay for the things that we need to do? We know that the vaccine is here and that it's going to be coming, but we also know that it's not an overnight fix, that we still have 6 months before we have everyone fully vaccinated and the light at the end of the tunnel, I guess.
Well, Patty, our seniors deserve the best care possible, and those who care for them do not get the credit that they deserve. I thank you for your time, for talking about this. Yeah, and we'll see if there's some follow-up that we can do. I know that there's much more to come down the road.